it's really easy for people to forget what you're going through, like on a day-to-day basis, every single day. But then October comes around and it's like, oh, I remember. You're doing this, you're doing that. But it's like, it's not just October for me. It is every day, all year.
From having an initial diagnosis, the kind of support that people gave, and then to a metastatic diagnosis, it's so incredibly different.
As the years go on, and I've had it for 3 years now, metastatic breast cancer, I find people think that I'm okay, that there's nothing really wrong with me.
I may not, quote unquote, look sick to you, but that does not negate what I am experiencing every day. I'm still in active treatment. So, just because I can throw on a wig and some makeup does not, take away from what I'm dealing with. And that's hard for people to understand.
I've accepted where I'm at in my life with my cancer. But I think with loved ones, I just find that they want me to be all right, and they really haven't accepted my diagnosis. They have not accepted it at all. They think that some wonder drug's going to come out. Something's going to happen and I'm going to be well again. So I'd like to say to families whose loved ones have just been diagnosed to just be there for them. You don't need to say it's going to be all right. Just listen, really. Listen to what your loved one's saying.
There are going to be highs and lows on this journey. So you've got to be there through it all. Cancer does not end when chemo ends. So it is important to note that just because someone is done, per se, with an active drug treatment doesn't mean that cancer is over. It doesn't mean that they can just erase all of what they've been through. You still have to be there to support them.
You want to feel, like you're not an outcast. And many times this diagnosis can make you feel that way. And it's just so important to feel loved and connected and supported by your family members.
Being diagnosed with metastatic breast cancer, I know we do a lot of advocating for ourselves and, being involved in our treatment plans and things. But one of the things I wish that healthcare providers could do is to kind of help us out in that area and advocate for policies and changes and things that would help benefit our community. Also, do a little bit more education with patients so that we know the things to look out for.
What is presented to a patient has extreme effects on the future of their life.
Just to know about the red flags and to be told what I should be looking out for. I really didn't know what to look for. That's why I'm really happy about these Facebook groups with metastatic breast cancer. And I feel it would probably be great if the hospital could actually hold some kind of discussions for us to come to.
The metastatic breast cancer journey has been a pretty intricate experience, and it definitely varies from person to person.
There's some people who want to know all the information, and there are some people who want to know zero information. And as a healthcare provider, really understanding and treating each patient as an individual and as a specialized case is so important.
I would tell my past self to give yourself grace. This is a journey full of highs and lows. Some days you're going to find yourself on top of the mountain and everything's great. And then some days you're going to be in the lowest valley that you've ever felt like you've been in. And both of those situations are okay.
One piece of advice that I would give myself would be to trust myself. I didn't always know the answer or the direction or, the options. But when I trusted myself to show up to the doctor's appointments, to ask the questions, to be present, to do the hard work, to heal myself, my results were better and better.
When first being diagnosed with cancer, had I known where I was going to end up with the metastatic breast cancer, the advice I would give myself would be to love myself, look after myself, do things, everything that I want to do. And I went through a period of time thinking, what's it all worth? What's it worth living for? But now I'm back to having facials once a month, looking after myself, living life, living it to the full.
Go out there and live and make those memories. Cancer is a part of your life, but it is not your entire life. So just continue to go out there and thrive.